People with type 2 diabetes produce insulin. However, either your pancreas does not produce enough insulin or the body cannot use the insulin adequately. This is called insulin resistance. Anyone can get type 2 diabetes. However, those at highest risk for the disease are those who are obese or overweight, women who have had gestational diabetes, which is when you have diabetes during pregnancy, people with family members who have had type 2 diabetes, and people with metabolic syndrome, which is high cholesterol, high blood pressure. In addition, older people are more susceptible to developing the disease since aging makes the body less tolerant of sugars. Smoking, an inactive lifestyle, and certain dietary habits have an increase of developing type 2 diabetes. The causes of type 2 diabetes is not well understood. There's multiple factors that can cause it and not a single problem. Symptoms of type 2 diabetes can include increased thirst, increased hunger, especially after eating, dry mouth, nausea, and occasional vomiting, frequent urination, fatigue, which means that you're kind of weak, you have a tired feeling, blurred vision, numbness or tingling of the extremities, and frequent infections of the skin, urinary tract. Type 2 diabetes is diagnosed by a simple blood test. 2 fasting readings of your glucose greater than 126 considers you to be diabetic. A complication associated with type 2 diabetes can be retinopathy, which is damage to the back of your eye, the retina, kidney damage, which includes spilling protein, peripheral arterial disease, and neuropathy, which is numbness, tingling, in the lower extremities. Yearly checks when you are diabetic include a flu shot. We check your urine every year to see if you're spilling microscopic protein. We obviously do not want you to be smoking. We're also going to do an eye exam, an ABI index, which is looking for the peripheral arterial disease. So once you're diagnosed with diabetes, you're always considered to have diabetes. You need to get an eye exam every year. We need to do the ABI index every year, checking for the peripheral arterial disease. We obviously need to check your hemoglobin A1C every 3 months and check your cholesterol and your CMP. You do not have to be on medications if your diabetes is controlled. So lifestyle modifications can include decreasing the carb intake, decreasing your sugar intake, and exercising. We do have a diabetic clinic at the office, which you can come in and we'll teach you about nutrition, and we like to follow the glycemic index, which includes we want you having 50 grams of carbohydrates per meal. And we can give you information on the glycemic index of foods, including carbs, including fruits, including nuts, just daily food that you take in that show how much carb intake that each food has. So anything less than 50 grams per meal is what we want you on. And then normally we start people on metformin, which is the first medication we usually start. But again, you do not have to be on a medication if you are controlled. And controlled means obviously having your blood sugar between 80 and 100, fasting, and your hemoglobin being under 7. We do actually have a weight loss management program here at the LoCicero Medical Group, which you can be started on. It does include some dietary supplements, there's shakes, different things like that, but also we recommend exercising at least 5 times a week, 30 minutes. It can be any type of cardio exercise that's going to increase your heart rate. And we do have information on that we can give you during the diabetic clinic. At a lot of restaurants nowadays, there are like healthier choices that you can pick from, and we try to advise staying more to vegetables, bland chicken, things that aren't fried, just those starchy carbs like breads and stuff like that. So if you try to avoid that, not drinking caffeine, alcohol, beer does have a lot of glucose in it, sugar, so staying away from those type of things will prevent or improve your diabetes. We're obviously your provider. We're here to discuss any, symptoms that you're having, any questions you're having, any concerns, and that's why the diabetic clinic is good, because we will be giving you an actual pamphlet of information that has, recipes in it, the yearly checks that you need, symptoms of hyperglycemia, which is your blood sugar greater than 240, and then symptoms of hypo, which is less than 60, and then little schedules that you can write for exercising and monitoring your blood sugar. And that's why we like to at least see you every 3 months, so that we are watching your hemoglobin A1C, your cholesterol, your liver enzymes, and we can decide if the medication that you are on is working, if we need to make adjustments. And if you have any other questions, during that time, we can answer it.